nerve examination. Very good. Now, I hope you don't mind, but due to the nature of it being a bit after hours, we will be using the bar area of the train as our clinic is currently occupied. Very good. Now, don't worry. I have all the necessary equipment to give you an excellent cranial nerve examination. So, to begin with, I would like to ask a few quick questions. Is that alright? Excellent. Now, I just want you to know that if anything makes you uncomfortable, you can always let me know and we will stop immediately. It is a bit after hours, and part of, I guess, this different environment is ensuring the comfort of our patients the most. Okay. Right. Name and date of birth, please. Excellent. Next, can I ask when the last time you got a cranial nerve examination was? Okay. And do you find things such as doctor's visits or going to get a haircut, do you find events such as that to be relaxing? Excellent. Thank you very much. So, now I will begin. The first step is to observe your facial structure. I will be using a small light to assist me. Is this too bright? Excellent. Right now, I am just looking for any symmetry or asymmetry. This is purely for medical reasons and to help establish a basis to work off of. Excellent. Can you turn your head as far to your left as you can? Thank you. Now, this is doubling to give me a look into your ear and test some motor capabilities. Can you look in the other direction, please? Excellent. Very good. You're doing a wonderful job. Excellent. Now that is, you can look straight ahead. Very good. That is all I need for a brief skin examination. However, I would like to ask that you do 2 more quick motor tests involving your neck, and we will move on to the rest of your motor capabilities. So, can you look as far up as you can, please? Very good. Now look as far down as you can. Excellent. Now, moving on to your facial capabilities. If anything hurts during these tests, please stop immediately and tell me. Do not do anything you might not be comfortable with, both physically or, I guess, just in terms of how safe you feel. So, can you open your mouth nice and wide? Excellent. Now grit your teeth. Good. Open up again. Can you raise your tongue to the roof of your mouth? To the side. Either side works fine. And the other side, please. Excellent. You can close your mouth now. Next up is the eyes. Can you look up for me? Excellent. Look to your left. Very good. Right. Excellent. Now down. Good. Look straight ahead. Blink a few times if you need. Now, if you can, close just your left eye. Now your right. Excellent. Very good. Can you raise your eyebrows? Thank you. Can you furrow your eyebrows? Very good. That is all for your motor capabilities. Excuse me. I will be writing this down real quick. Your results so far have been phenomenal. You have nothing to worry about. Next up, I will be focusing on your eyes. To start with, I would like to take a look at your vision. Let me pull up my vision chart. Excellent. Now, can you read down as far as possible for me? Thank you. You're doing excellent. Okay. Very good. Do either of those lines appear thicker than the other? Excellent. What color is this line? Very good. Now this one. Excellent. You're doing wonderful. Next up, I have a color test for you. What color do you... Excuse me. I meant to say, what letter do you see here? Good. Here. What about here? Excellent. Down here. Here. You're doing wonderful. Last three. A small fun fact. These last three tiles are meant to be easier to understand if you are colorblind. Although, even without being colorblind, I can read them quite clearly. But thank you very much. You did an excellent job. Next up, I will be using the final feature of this chart, the pupil size chart. Look into the open eye. I will be placing this right on your eyebrow. Blink if needed. I promise to be careful. Okay. Got about 7 mil in both eyes. Excellent. Moving on to your actual eyes themselves, and not just the vision. I ask that you look at my finger, please, and hold your head steady. If you feel any discomfort, double vision, blurriness, or anything unusual, please let me know. It can be very relaxing. Okay. Once more. finger still and follow it to your nose. Let me know, once again, if there is any discomfort, double vision, or blurriness. Okay? Excellent. Good. Once more, please. Good. Now I will be using a small light once again and shining it in your eyes. If it is uncomfortable, do let me know. Well, it's going to be a bit uncomfortable, but if it's too much, please do say. I promise this will not hurt. It is just to observe your light reactions, and later on to look at the whites of your eyes. Please focus either on a point behind me or on my nose. I am observing your left eye and its direct response. And consensual. Excellent. Now for the other eye. Very good. Now for the potentially more uncomfortable part. I'm going to be observing the whites of your eyes. I will be holding up your eyelid during a brief portion, but I promise to be quick, and if you would like me to stop or not continue at any point, you can always say, this is not mandatory. So, look up for me, please. Excellent. Now look down. Do I have permission to raise your eyelid? Thank you. Okay, brief. Excellent. Look to your left, please. And your right. Very good. Now for the other eye. Look up once again. very gentle. Good. Now to your left, please. Good. And your right. Excellent. That is all I need to do for your eyes. You have been doing an amazing job. Thank you very, very much. Okay, now our final test involves the hearing. I will be doing a simple clicking test. I will make a noise in your ear. Tell me how many you heard. To begin with, may I get close to your ear? Thank you. We can stop whenever, as always. Excellent. Very good. amazing job. That was the last one. You did excellent. So, I will mark that down real quick. Thank you very much for coming in today. All of your results will be available as soon as you reach your stop. Now, as I am aware, I believe it will be a lot longer before we get there. So you can safely take a nap. Do not worry, an attendant will come and wake you. Thank you